Thank you for coming to my interview.
Oh, thank you for having me.
We're going to start by saying, what is your full name?
Aislinn Sloan Williams.
And where are you from?
I'm originally from Houston, Texas.
Okay.
From the north side.
Yay. And what is your employment background?
I have been employed as a registered nurse, a teacher, an administrator, and now I'm currently the school nurse at Milby High School, and I've been here for 4 weeks now.
And so what are your duties and your responsibilities as the school nurse at Milby High School?
As the school nurse at Milby High School, I'm responsible for the safety and well-being of the students, and that includes preventative care, health screenings, immunizations, taking care of students with chronic health problems, you name it.
And have you ever worked at a hospital?
Yes, I have. I actually started out working at LBJ, which is now Harris Healthcare System, and I was an ICU nurse. I worked in the intensive care, those patients that came out after surgery in surgical ICU. I did that for a little while. After that, I became a radiology nurse, and after then, I've worked in psych. I've done a number of things.
So you're an RN nurse as well?
Yes, I'm a registered nurse. That's actually how I started out as a registered nurse. I started off in school nursing maybe about 20 years ago. After a few years of doing school nurse, I was ready for something else to do. I don't know what I want to be when I grow up. I just constantly keep evolving and changing. But after then, I went to work for Barbara Jordan High School for Careers, and I became a health science teacher. And health science is a career and technology course for students who are interested in anything in the healthcare field. So I taught that for about 7 years. After that, I decided to become an assistant principal. I did that for about 5 or 6 years.
At what school?
And I've taught at, been an assistant principal at Contemporary Learning Center and DeVry Advantage Academy. And now I'm the school nurse at Milby. So.
And did you know early in life what you wanted to be?
Yes, I did. I knew early I wanted to be in the healthcare industry. I think it started when my dad had surgery to remove his gallbladder. I saw how the nurses and the doctors interacted with the patients, and I was like, yes, this is the field for me. And so I went to DeBakey High School for Health Professions, and I learned more about nursing and just decided that was the field for me.
And you already said that your dad's gallbladder surgery influenced you. Did anything, like, did a person influence you? Did anything else influence you to become a nurse?
Yes, I would say I have several family members that are in the healthcare field. My aunt is a nurse. She's retired. I have several family members that are teachers. And that's one of the reasons why, another reason why I decided to go into teaching health science technology. I'd say the two most people that influenced me would be my high school teacher that taught health science. Her name was Miss Deborah Swanke, and basically she taught me a lot about nursing skills, how to make up beds, take vital signs, and taught me a lot about terminology and anatomy and physiology. And I credit her because I wouldn't have made it through college if I wouldn't have learned those skills in high school. And so it really, to me, gave me an advantage over other students because I knew some of those things and it was easy for me to make it. The second person I'd say that really influenced me was my mother. She was an educator. She was a special ed teacher, like your mom. And I mean, she just had a passion for students that were in exceptional ed, and she taught for 37 years, and so, I mean, teaching was just natural for me, and it really comes natural for me, whether it's a patient, whether it's a child, it doesn't matter. It's just, I think that's my gift.
That's amazing. There's a lot of people that's just not inspired that way. And do you plan on continuing your education and going to doctor?
Yes, I have my master's degree in counseling and education. I have 18 additional hours in nursing, and so about 2-3 years ago I was an adjunct faculty at HCC, and that's my goal now. I want to go back to teaching on the collegiate level so that I can inspire others to be in the healthcare field and go further. I've been kind of thinking about going back and getting a doctoral, but I got a kid in college and another one going to go to college, so I may have to put that off for me.
And what do you like most about your job?
I like interacting with the students. I think that's the best part. Giving them information, providing care for them, just serving as a knowledgeable person and meeting their needs. I mean, they make sure that the day goes by fast, not boring, and they just, you'd be surprised at some of the questions that they have.
And what do you like least about your job?
What do I like least about my job? I would say it's sometimes the bureaucracy of having a job. Things that you can and cannot do because of red tape or because of policies or things like that. Don't get me wrong, policies and procedures have a place, and they provide us with a baseline, but sometimes it gets gray. And you have to be willing to make decisions or do things that's in the best interest of students. A lot of times we say that, but then at the end of the day, we do something contrary to that. And so that is frustrating for me, because if we're really here for kids and to serve and meet their needs, then if it means changing a policy, if it means doing something different, that's what we need to do. We can't just, say one thing. We have to be able to walk the talk. So if you don't, then that's frustrating for me. And I'm an advocate about changing that so that it benefits not just a small group of kids, but a lot of kids.
Okay. And in what situations are communication pitfalls or challenges most likely occur?
I think challenges occur when kids don't understand some of the reasoning why, or some of the decisions. Like kids come in, Miss, do you have something for my headache? I need some medication. You can't give me some Tylenol or Advil, and the answer is no, I can't. And things that you can do. Sometimes barriers in communication. I know a little Spanish. I know a little sign language. So sometimes talking to other students or getting other individuals to translate is big, and making sure that students are learning themselves how to take care of them, and of course impacting their family members. When they learn something new, I tell them all the time, go home and teach it to somebody else, because when you can teach it to somebody else, you actually know it, and somebody in your family needs to know that. I mean, I had a student the other day. He came in for one reason, and while we were just talking and I was finding out information about him, what he wanted to do, I noticed his neck. And I said, have you been feeling okay? And on and on. He said, no, Miss, why did you look at my neck? And I said, well, that is an indicator of being at risk for type 2 diabetes. And I pointed him over at the chart, and he started looking, and I started asking about his family history. He was like, yeah, that's true, Miss. I never thought about it that way. And so I gave me an opportunity to talk to him about more fruits and vegetables and water. He was like, yeah, I understand now. I said, well, I'll give you a brochure. If you have more questions, come back later. So,
and are brochures and pamphlets or other materials provided in another language? Anything lost or in translation?
yes, we really do. We provide things in multiple languages. Sometimes we have some kids who are of a different language and dialect. Excuse me, like we have a student that's from India. We have a few that are Vietnamese, and so our primary language we translate into is Spanish. So sometimes the language may mean something different, so there has to be clarification. I always ask students or parents, do you have any questions? Because when you ask them, do they have any questions, they'll be like, okay, yeah, I do, and it may not always be related to the brochure, but just to make sure that they walk away with a clear understanding.
Okay. And does your gender play a role in how you communicate or how others communicate with you within the job?
I would say it does. I definitely would say that it doesn't. Being a mother myself, I talk to them like they're my children, and so it definitely plays a role. What you say to young men are different to young women. Believe it or not, the young men a little bit more shy than the young women. They tend to be bold. You know, oftentimes they'll say, well, can you ask, you know, because they really don't want to know. Or if if you interact with male students, they want to wait till nobody else is around so that they can have your full attention. Whereas female students can understand if I'm multitasking and they're still listening and getting the information.
And does your age have an impact on the job communication?
I would say that it does too. It definitely does because it plays a role in how you can relate to students. You know, you're there as an adult and a figure, and you don't want to be a friend. You're a resource, but you want them to feel comfortable telling you key information. And you want to be able to discern and be mindful that a lot of times things can get lost in translation. So you have to kind of ask, okay, well, what do you mean by that? You know, Miss, you getting corn, what does that mean? Well, it may mean something different in my generation than it does to your generation. So FYI, just clarify for me. Oh, Miss, you be, you know, so yeah, it does matter. Okay, leaving for me right there. Thank you.
And what role do nonverbal communication cues play in your work environment?
It does. You have to be able to, Marisol, answer the phone for me, please. Repeat the question again, I'm sorry.
What role do nonverbal communication cues play in your workforce?
A lot of times you have to, you know, if a kid comes in saying they're sick, you have to watch their body language, their facial expressions, making sure that it's consistent with what they're saying. Sometimes just reading that it's something else going on than what they originally came for. So it's important for you to notice all types of things, to be very observant, asking key questions. Even ones that the kids may feel embarrassed or awkward about. Okay. I would say.
So, do you have any final thoughts or advice to give me?
Yes, I would. I would say that communication is a very important part of any career, whether it's verbal communication or nonverbal communication. I think the thing that has really made the difference in my career is active listening, taking the time to really listen to what is being said, hear what's not being said, asking clarifying questions to get to the point, and making sure that you're always checking for understanding. Just like with the conversation, sometimes what we convey and what we think we're saying is not really received by the receiver. You know, the sender has to clarify and constantly check to whether or not the message that they're trying to convey is coming across as clearly as possible. Communicating with people genuinely and in a positive manner, listening to what they have to say, I think is critical. And it'll take you a long way, no matter what field that you're in. I remember my speech class in college. It was fun, it was exciting. At the same time, it was a little bit out of the box because we had to talk to people who I wasn't accustomed to gathering information from, especially people with different backgrounds, culturally, economically. But once I gained those skills of getting in the habit of interviewing clients, it came natural to me. So one of the things I would encourage you, any of your classmates to do, is after you ask a question, go back and ask that same question, restate it and clarify it, and give people an opportunity to expound or provide more detail on that question, and give them an opportunity to express themselves, and that way they feel like you really listened and heard them and what they have to say.
Okay. And thank you for letting me interview you.
Absolutely. Sorry it took so long and we had so many interruptions, and hopefully I gave you enough about me and answer some of those clarifying questions.
You did.
I hope that you have success in whatever it is that you are planning to do as a career, and that you love what you do, so that it doesn't matter what area that you're going into, that you embrace it and take advantage of it.
Thank you.
You're welcome.